So there is a slight change to the session today. We've got Justine, who's joined us at very last minute, and I'm really pleased that she has been able to join us, because I was in the process of sending out an email yesterday, and then fortunately I managed to speak with Justine first. It was around opportunities that have arisen within the blood and transplant service, and there are a number of opportunities there. And rather than me do injustice and talk about those requirements, I've asked Justine, who works for that service, to come and talk about those, what the service does, how it works, what the requirements are, and some of the future potential requirements that will be emerging within that service as well. So we're going to have Justine talk about this first. The HCA opportunities, I'll talk about them based on the pathway that was shared on the menu of opportunities, as Jane unfortunately has not been able to sort of commit to this session due to other commitments that she's had come through that have overtaken her diary. And then we'll conclude with Fidelma, and she'll talk about some of the emerging roles or some of the current vacancies that she's got within Berkshire Care Association. So without further ado, I will pass it over to Justine, and the floor is yours, my dear.
Thank you very much indeed, and hi everybody. Just to give you some background, I'll just talk a little bit about NHS Blood and Transplant, just to give you an idea of what the organisation does, and just how some of that works and where we've got potential opportunities for people. So the service itself it will be mainly, you probably know it, and some of you may well have even donated blood over the course of the last few years. But basically, the service collects blood predominantly, but also there's with regards to all kinds of organ transplants and collections that we do as well. One of the key things that happened during the pandemic, which was quite again a change to the service, is that we started collecting plasma for the first time in probably about 20 years. And this was in response to the COVID pandemic, and we were collecting plasma on a program called Convalescent Plasma, because at the time, at the beginning of the pandemic, one of the things that we were looking at is whether or not plasma could aid with COVID recovery. This was prior to the vaccine being developed. So this is one of the things that prompted the plasma collection to begin again in the UK, because we'd been previously getting all our plasma mainly from the US. And that's prompted a slightly different change in tack for the organisation, where now there is a permanent commitment that was signed off by Department of Health and Social Care last year, at the end of last year, to collect plasma donations as well as blood donations. Now, when I was speaking to Gaurav yesterday, I was trying to sort of find an analogy for you that would just give you an idea of how NHS Blood and Transplant works from a collection perspective. And the best scenario I can give you, it's a little bit like a retail organisation in the way that it's set up. So if I take Tesco, and I know the supermarkets are available as well, but if you look at your Tesco model, you would get a Tesco superstore as your main sort of static site, which is what we've got. And then also you would have your Tesco Expresses, so your smaller scale sort of convenience store and local stores, which is really how our local collection sites operate. And so we've got sites that have got a number of people that are based on site on a permanent basis, and we've also got, I think, somewhere in the region of about 50 to 60 essentially mobile collection units as well, that are all based across different areas in England. So our opportunities, our immediate opportunities at the moment, are around what we would classify as team assistants, which are band 2 roles, where these are individuals that would essentially be sort of a front of house type role, where that individual would be responsible for meeting and greeting the donors that come through on session, and then taking all the details of the donor, booking that donor into the into the session, and arranging for them to begin or start to give their donation, and then keeping an eye on those individuals after they've donated. So it's that type of role that we're looking for at the moment, and these roles are across the whole of the southeast. So we've got mobile teams in and around the sort of the Surrey area, so Epsom, Horsham. We've also got further afield more in the Berkshire area and sort of Reading area as well, and then down into East Sussex area, so Brighton, those sort of areas as well. So covering the whole of that sort of essentially the geography that Frimley would cover as well, and also going into along that M4 corridor or in towards London in sort of Twickenham as well. So we've got those roles that are immediate, and we've also got roles that are band 3 roles, which are our donor carers or healthcare assistant roles, and these are roles where the individuals there is a 6 weeks training program for these particular roles, and then these individuals would be responsible for actually taking the donation from the donor themselves. So there's venipuncture involved within that process, but as I said, there's a whole sort of 6 weeks worth of training that goes alongside that, and all donation sessions will be covered by a nurse as well. So you've got the nurse in there just as the sort of the clinical lead with regards to that. Other opportunities we've got, but I'm not sure that they would be in locality wise would work for people here. We, as well as the collections work that we do, we've also got several manufacturing sites where blood or plasma donations would be taken, and then there would be a manufacturing process that would then be undertaken on those products before they were used. From a blood donation or from a blood perspective, what happens is the blood will then be go through process, and then it would be then sent out to the hospital services network, obviously to support with A&E functions and obviously your operational functions as well. So that's a little bit about NHS Blood and Transplant. And Gaurav, does that give you as much as you need, or I'm conscious that I've rattled through everything fairly quickly, but hopefully that just gives you a bit of an understanding about what we're about and our immediate needs.
Absolutely. I mean, I've just jotted down a few notes whilst you were talking, and I just thought, just to make it easier to break down what you've said, I'll ask a few questions just to reiterate some of the points.
Yeah.
But with the band 2 team assistant role that you've mentioned, one of the communications that I received from Region was that even if our band 3 staff applied for that role, they would be reimbursed at a band 3 rate simply because of the requirement that we have on the ground at the moment. So what I don't want to do is ostracize the band 3 staff that I have from applying to those roles, because absolutely they would be able to do those roles, and they wouldn't sacrifice the salary as well. So they'd still get paid at a band 3 rate, even though the role is a band 2 admin or assistant role, team assistant role.
That's
So
correct.
just to clarify, is that correct?
Yeah, that's correct. Yes.
So that opens up the floor to all band 3 staff on the call as well. The other thing was just to ask about the training. So you mentioned if you were to do this team assistant role, there'd be a training day. What does that constitute?
So the training day, and we have just to let you know as well, we have a training site in Horsham as well. So which is fairly local. So the training day would be it's a full day's worth of training, and I think if I haven't done already, Grav, I'll share the program with you afterwards as well, because I can send that out, so there's full detail on there. The main part of the training, and it needs to be, all the training or the 1 day training has to be face to face, which is why there's a need for people to go to the training centre, and it will go through a number of things. some of which will probably be mandatory. Well, I'm sure will be mandatory training that people have already had if they're obviously currently working for you anyway. But the elements that are important to us are the use of the Nhs system, which is a system that we use for booking donors into sessions. So there's an element of that, and it's also just the training on just what the expectation is from the front of house role, so that essentially the meeting and greeting and the information that you would need to take from the donor and just what we do with that. And then there is also an element that covers when the team assistant who does the observing after the donors have given their donation, there is an element in there of what the team assistant would be required to do if in the event that there is a problem with one of the donors after they've given their donation. So it's to ensure that there's the correct procedures are being followed after that as well. So it's just to go through so everybody's comfortable with the requirements of the role and what to do in the event that if there are any issues or any problems that come about through the session.
Thank you, Justine. And then I've just looked on the chat. Jeremy's asked who will be the contact for the donor service. Now, I know that you'll be sending information to us, and one of the follow-up questions I was going to ask was a bit like last week. At the end of the session, you know, we asked if we could share any of the contact details of the individuals presenting, but also for the presenters to provide any other information or any list of vacancies, or in this case, it'll be the shifts that will be coming ahead and then the training days that will be available. That will all be shared by yourself, and then we'll disseminate that out like Berkshire Care Association did last week. So in similar fashion, we'd expect that from you, right?
Yeah, that's correct. And we've got we've got training days that and training sessions that have already been pre-booked, which I'll share with you. The way that the organisation, and this is where this becomes we're a little bit short of time for some of this, because the way, and we are working on this to try and get an idea of what our requirements will be with a bit of a longer time scale, because at the moment the sessions are only planned 2 weeks in advance, which is we need, in order for you to help us and for us to be clearer to you, we need to be a lot more clear than we are. Unfortunately, we're in a position to the moment just to be able to plan ahead, so we can work with you like that. So we've got sessions for the next 2 weeks, but bearing in mind where we are with training, we need to give you something that's basically essentially would probably cover the best part of the next 6 weeks if we can. But for the way that the shifts are set, it's just proving a little bit challenging for us to get that information, and I think it's, until we do, it is going to be a little bit difficult just to predict exactly where our requirements and our needs will be for the team assistants, but we are working on it.
Thank you. I can see we've got a hand up. Jeremy, you've got a question.
Yeah, it wasn't about contacts, Gaurav. It's about the contract. How's the working relationship between the donor service and the ICS? Do we go there as a deployment to the donor service and then get paid through the Workforce Bureau, or do we sign a different contract with the donor service and get paid by them? How does that relationship work?
So we've been told by NHS England that there is a sharing document that we need, that we can sign between us. So what will happen is the individuals would continue to be paid by yourselves through whatever bank mechanism and payroll mechanism you use in that instance, and then there would be a recharge back from you to us, and we would then pay you through that route. So essentially the bank relationship would be maintained with yourselves, and it's that recharge.
Yeah.
Correct.
I'm just thinking it's just that, you know, obviously we when we go through these changes, we're doing it now to become HCA vaccinators. We have to go through that arduous task of going through recruitment and selection. We don't really want to go through that again, but would there be a requirement to go through that task to get an assignment number -4, -5 or -6?
No.
Good.
So in a nutshell, no. The answer is no. So how this would be treated would be how we would disseminate or deploy any of our staff now to primary care networks if there was a need. So it would just be another service that you'd be lending your support to, but with the caveat that you'd need to go on that training course first. Now that stands firm for the team assistant role. However, some of the other roles that Justine mentioned around the HCA roles that require the 6 weeks worth of training and any greater commitment, there may be discussion then at that point for those roles around whether that would be directly with the service or whether that would still be something that is run through the lead employer the way that we're running the team assistant role.
Thank you.
Okay, I think Primla's asked a question as well around the 6 week training program. Is it continuous or is it a week at a time?
So when we onboard our healthcare assistants, it's 6 weeks and it's continuous. So it is a full-time training commitment. We can have a degree of flexibility around that, but the preference is that people would undertake that training on a full-time basis for 6 weeks. And what would happen is essentially the HCAs would be allocated to a obviously wherever the vacancy was, but obviously it would be a team that would be geographically close to where people live, because for that you can't be obviously traveling all over the place for that.
Thank you. Beverly.
Hello. I just wondered, is this a bank role or is it a permanent role?
The TA role at the moment would be a bank role. Essentially the HCAs or donor carers, it will be a permanent role, and we've got I mean, again, I don't want to be poaching your staff graph here, but we're constantly looking for donor carers and HCAs, and our primary method of attraction there would be NHS jobs, and everything would be on there or through the NHSBT careers website.
Oh, okay. And what about how long are the shifts?
So the shifts are it depends a little bit on whether or not it's a static site where it's a bit more, where the shifts are then more regimented. Usually the collection teams are usually on site from probably about 8 in the morning to 8 in the evening, but they can be on sort of split shifts just depending on what the requirement is. So the full time is the sort of obviously 37.5 hours, but it can be split in a number of different ways, because there's many of the mobile, not the static sites we're trying where possible to operate a 7-day service because of the collection targets and obviously the need there. The mobile sites are not necessarily 7 days a week. It just depends on the throughput of where the donors are and where we know we can get to, essentially.
Oh, okay. Thank you. Thank you.
Thank you, Justine. And I think that answers Eve's question as well around the bank work for team assistants. So clearly there's a degree of flexibility there, and that's very much the model that we've employed in the mass vaccination site, where there are, all shifts in 4-hour blocks that everyone's used to working and is really flexible around, personal schedules and other commitments. So it really lends itself to a greater uptake. I guess, would it be fair to say that we should encourage as many of our staff to consider this opportunity if it suits them? Once we get further details from yourself, we'll share that, and then they book themselves onto that training day, which is paid, and then they're in a position where when those shifts do come up, whether they're on a fortnightly basis or a longer term basis, ideally, that they can potentially look to, resume or continue some work through your service.
Yes, yeah, that's it. And I think, as I say, this has all moved really quickly for us. So I do apologise for us not being as as clear or as concrete as we would like to be. But I think it's sort of moving at pace. And I think to give you some idea of just why it's happening like this is because, as I'm sure you, obviously with the weather the way that it was on Monday and Tuesday last week, obviously it's a huge issue for collection teams and for donors as to whether or not we can actually take donations in that type of heat for all the clinical reasons around there. But that 2 days has got a massive impact on obviously on collections going forward, and it therefore has the knock-on effects going forwards to blood stocks is huge if we can't collect. And that's something it's always very cyclical within the service anyway, it particularly around sort of key holiday times and things like that, and weather and all kinds of things just sort of affect those how and where we can and when we can collect. So it's running. It's interesting because the number of donations actually went up through the pandemic, but since then it's dropped off again. So it's just it's encouraging people from everywhere, from all walks of life, to come and donate what is a life-saving product. So we're heavily reliant on our staff resources to be able to collect, but we're equally as reliant on getting the donors through the door to be able to support that as well. So it's a bit of a balancing act at the moment all round.
Thank you. And I guess just to answer the last question we got from Martine there, they won't be bookable through the app, Martine, because this is a separate service. It will be a manual process that we'll implement once we get a bit of an understanding of what that forward view looks like. But obviously, as and when we get that information, we'll share that out and try and get as many people A, trained, and then B, onto those shifts as and when they become available. But I'm just looking at the time, and I know that you kindly, come across that very last minute notice, and you've got half an hour, and we're almost up with your half an hour. But I just wanted to say thank you on behalf of us and the ICB for coming across and presenting the opportunities to us, and do look forward to receiving more information from you, Justine, and we can then hopefully get the service up and running and support in any way we can, because I know that we've got some great people who are still looking to do work outside of the vaccination programme. So thank you.
That's fantastic. Thank you very much. And I'm more than happy to take any questions. If you want to forward anything on to me, go on. That's again, and if anybody wants to have a further conversation, by all means, please just drop me a line.
Certainly will do. Thank you so much.
It's lovely to meet you all. Take care. Have a nice day. Thank you. Bye-bye. Bye.
Bye. Okay, so now we'll move on to our second part of the agenda, which is going to be focusing on Berkshire Care Association. We're kindly joined by Fidelma today. So last week we had Cliff and Sharon. This week we've got Fidelma. Hi, Fidelma. How are you doing?
I'm good, thanks, Gaurav. How are you?
Yes, very well, thank you. Very well. I'm happy to see that you're here, and I know that you're always bustling with energy and really wanting to get Berkshire Care Association on the map, and I'm really pleased that we can do that for you, and we're all part of the same system. So absolutely, as I said with Justine earlier, the floor is yours. Please talk about the organisation. Please talk about the roles that you've currently got available and the opportunities that present themselves that not everyone will necessarily know about.
Yeah, okay, thank you. I'm afraid I've got crying children behind me somewhere. There, I'm trying to keep them quiet at the moment, my son, but just in case, it's my nephews rather than my children. Okay, so the Care Association is the umbrella organisation for all of the CQC registered social organisations within Berkshire. So if somebody is a care home, domiciliary care, learning disabilities establishment, or sometimes there's services that are kind of outside the normal, like drug and rehabilitation services and stuff like that, they are all members of the Care Association through the fact they're registered, unless they opt out. So it's not an opt-in, it's an opt-out organisation, and the Care Association tries to represent and assist and guide services if and when they need it, for whatever it might be, organise conferences, go to meetings like this and lots of other ones, etc., etc., etc. So each organisation is a registered business in itself. So each care home, it may be part of a big organisation like Care UK, which are national, or they might be just one small off little home or domiciliary care. They might be geographically within a 5-mile radius, or they might be a national group that they go absolutely everywhere. There's a huge variety. Everybody is looking for care assistants, cleaners, chefs, well-being assistants. So the well-being assistants do everything other than personal care, more or less help with activities of daily living other than the personal care elements of it. Kitchen porters, anybody who can do anything basically. Some organisations will accept people who can work school hours. Some organisations will insist that people shift work the same as everybody else does, but it can be part-time and full-time. We have shifts that go from maybe 3 hours a week up to 40 hours a week as normal, but we don't work in a band situation the same as in the NHS. We work on usually, but not always, on an hourly rate or a salaried position. So when you talk about band 2 and 3, I don't really know what you're talking about. I know what it means, but I don't know how much people earn. And the pay goes from the national minimum wage right up to maybe 11, 12 pounds an hour, unless you're a registered nurse, in which case usually it's around the 18, 19, 20, 21 pounds, depending on experience and what people can do and so on like that. The difference, I suppose, in our organisations to working in the NHS particularly is that you are very much nurse and care led. You don't have a doctor or other people around to guide you and support you in what you were doing all of the time. So you have to learn skills and competencies that are way beyond what you would do in any other environment, I think. So, for example, you would lead a shift, you would do the medication. That would include things like controlled drugs, for example. You would be calling out the doctor if somebody gets sick. You would be doing the doctor's round. You would be communicating with the family if somebody was poorly or if they were dying. You would verify deaths. All of those kinds of things are standard stuff that happens in care environments on an everyday basis. And obviously there's an awful lot of training behind that goes with it. You'd also be doing things like mental capacity assessments and referring people for DOLs and so on like that, for deprivation of liberty safeguards. What I find incredible about this, working in this environment, is that you can make a difference to each person that you meet every day. And I know you can do that everywhere, but you can affect change directly. You don't have to go through the 400 policies you would have in a massive organization to make a difference in to that person today. You can get systems and processes changed because you will know your direct line manager, who will be the top boss, the registered manager, directly. You will know them by face, you will know them by name. They will be on call to you. You will be phoning them when you've got an issue that you don't know what to do with, etc., etc., etc. It's a much smaller, more intimate environment where you've got much more consistency of care. So you get to know your patients and your families really, really, really well. And in all honesty, you become very close to those people because you are looking after them very often for a long period of time. And you get to know all of the intricate details like you do about your own family in ways that you never possibly imagined. The other thing is that you get to meet, as you do in the NHS and everywhere else, you get to meet prince and pauper. You get to meet people from all aspects of life and the world, which personally I find quite incredible in the work that we do every day. The hours can be very flexible, like I was saying earlier on, but we often have people who will do maybe a 5 till 8:30 or a 6 till 8:30 or even a 7 until 10 or something like that, so that it suits people who've got maybe a partner coming home from work and taking over from the children and so on like that. The same in the morning hours as well. Maybe somebody who can come in 6 until 9 is better than not having somebody at all, and so on like that as well. So it doesn't have to be the set shift pattern that everybody's used to. It can be, some places do long days and do 2 or 3 long days a week. Other places do shift work, for 6.5-hour shifts or whatever it might be, that varies. Training is provided on the job and within each organisation. Your care certificate travels with you from A to B, but most organisations will retrain you in the way that they want it done anyway, because there will always be nuances. But you know, care is care, isn't it? Once you know how to do the basic jobs, you know how to deliver the direct physical care. It's the intimate details afterwards that are important. And of course, each organisation has got its own way of doing things as well. In terms of how to get in contact, you can contact the organisations directly, each care home, domiciliary care, wherever it might be. You can go to them, or you can contact, I will put it on the chat in a minute, info@boxcare.co.uk, and say which area you're in, and then we can help you to you know, branch out to whatever you might like to do, or have a conversation with us about what you think would be good for you, whether it's learning disabilities, care homes, domiciliary care, sheltered housing, whatever it might be. There's a lot of variety out there. I don't know if I can tell you anything else, really.
Thank you, Fidelma. Again, I've been jotting down a few notes, and I just thought it's useful, you know, given some of the experiences of the staff who have come on board onto the vaccination programme. You mentioned a number of roles there, and I'm sure there are many more as well. But the two which sort of stood out were the care assistant and the wellbeing assistant roles that you mentioned. Some of the others are a bit more self-explanatory, but it's just, you know, again, you've mentioned quite a few different, you know, aspects of the role. But with those two particular roles, what are the typical, what's the day in the life of, for example, a care assistant or wellbeing assistant, and what kind of things would they be doing that would be useful to share?
Okay, so you're let's say start an early shift. Your morning will start at 7:30, 8 o'clock, depending on the day. Come in, you get handover, or you're giving handover if you're the person in charge. You organise your team, set out, if you're the person in charge, you would set out who's working where, what things need to be done that day, who's got appointments that need organisation, who's going with them to those appointments, follow up on all of that. If you were the person in charge, you probably would be doing the medication, and going around the home, seeing all of the patients that are there. If you were in domiciliary care, you'd start with, you know, Mrs. Jones at 8 o'clock and Mr. Jones at 8:30 and so on like that, or would, you know, depending on the time slots that you have available. Within a care home, you would prioritise in the same way as you would on a ward according to clinical need, depending on the day, and of course depending on who's got appointments and what their routines and whatever else it might be. Assist people to get up, washed, dressed, have breakfast, you know, do physiotherapy type exercises with people who need it, give people a bath or a shower, whatever it is on that particular day that they need to deal with whatever comes up as it happens. You know, somebody is constipated, so you need to deal with that. Somebody's got a chest infection, so you need to call a doctor, and you need to, obviously you do their observations first and so on like that. And it would be your job to do those things as well. Now, obviously that would be with training, but you would do their observations before you would call out the doctor, and go through a process of elimination. You know, are they constipated? Have they got a UTI? Have they got cellulitis? You know, what else might be going on with them? What have they had their medication? Are they in pain? All of those kinds of things. Then usually a lot of people will regroup sort of at around 11 o'clock, or maybe have a telephone chat or whatever it might be, so that everybody knows what's happening in the middle of a shift to keep things going smoothly. Then get ready for lunch, and of course it starts the next medication round, so you've only just finished one and the next one is starting more often than not. And again, assist people with their meals. And of course they get choices as well, so it's not just, you know, what's on the menu today, it's also what would you like instead if you're not going to have that. So you might have to liaise with the chef, you might have to liaise with social workers and best interest assessors who are coming for appointments. You might have to send notifications off to CQC. There might be all sorts of things that, you know, people will fall, get skin tears, you know, accidents will happen no matter what you do. There will always be accidents that happen. Write your notes, write up the reports accordingly, like accident reports and so on like that. Update the care plans for the person, whoever is relevant on that particular day at that particular time. Finish your shift usually at around 2 o'clock, and hand over back to the next shift about what is happening for the rest of the day. And if you were a wellbeing assistant, you may also be doing things like, and even as a care assistant, you might as well be taking people out on trips. You know, it could be London Zoo, it could be you know, just to go to Tesco's for half an hour, just to get people out and do something with them, to take them shopping. It could be taking somebody to a chiropody appointment or podiatry or outpatient appointment for something else. You might spend all day there as well, unfortunately, sometimes. It purely depends. Every day is totally different. The one thing I can assure you is it's never boring.
Thank you so much, Fidelma. I guess I'm opening up to the floor. Are there any questions for Fidelma? I mean, there's a lot of information there, and clearly a lot of breadth of roles, and very much involved. So the training aspect has to, I guess, be quite involving as well to sort of cover all of the aspects that you've covered. Any questions for Fidelma on any of the particular roles or anything at all? No, not at the moment. In terms of further information, Fidelma, obviously there's a lot of information that you've just shared. Um, you'll share an email address, but is there information that we could get hold of that we could share, provide to everybody around these particular roles, rather than pulling a job description, or maybe that is what it takes, but just a bunch of roles that we could share and sort of get people involved in sort of understanding a bit more about what's required, and then the application process, and how, whether there any of their prior training. So with the VAX program, there was a bunch of statutory and mandatory training modules that everyone has been through. How many of them would qualify or would be sort of noted when, and they're all e-learning for health. So whether they would be accounted for when moving across or without duplicating the effort.
Yeah, I mean, the fact that people have been given vaccinations means that they're well up there in terms of being able to give medication, as an example. The system and the process is different because, if you're given a vaccination, the vaccination is the vaccination is the vaccination. Whereas in a care home, people have FP10 prescriptions, so community-based prescriptions. So your prescription, and the same in people's homes. So if you're on a ward, you would go and take the medication out of the medication cupboard, and the paracetamol is the paracetamol is the paracetamol. But in our environment, my paracetamol is mine, and I can't share my paracetamol with you. Okay, so you have to use each patient's drugs. So there are little nuances like that are very, very different, and frankly very frustrating at times as well. But it is the system and it's the process, and we can't. That's the one thing we cannot change. But all of those skills are very, very, very much transferable. Absolutely. Not everybody has wellbeing assistants as well. So some people they might call them activities assistants, or they might call them recreational assistants and so on like that. If people don't want to do the personal care element, but it will involve everything other than the personal care element of care delivery on every single day. As a wellbeing assistant, more often than not, you would not be the person in charge and doing the medication. It would usually be the care assistants or senior care assistants who would be doing that, or the nurses obviously as well, whether there are nurses involved, but there's not always nurses involved at all. But they're absolutely transferable. Training will be given absolutely in every environment when people start working. The process to get through is basically an interview, references. As long as you can get references fairly quickly, interviews can be held at any time and anywhere. That's not difficult at all. People can be very flexible about that. Weekends, evenings, all of that's no problem at all.
Yeah. And I guess why that's important is you probably heard earlier in the call where Jeremy was asking about, joining and whether to get another contract and how long that takes. I guess there's a lot of apprehension sometimes simply because of how long contracts have taken with our current lead employer. So just any small change takes forever to implement. And it's as much as I like making excuses for the lead employer, it's just down to capacity. There's just not enough people doing the job, and it takes a long time and leads to a lot of frustration. So, swift, agile processes of getting people on board, and not having as many delays really helps with the process and I guess just the experiential side of things as well, that you're not put off by the time you actually get there.
Yeah, no, all of that can be very quick and easy in our environments, and we desperately want people. We want you, we really do.
Super. Well, thank you so much, Fidelma. Like last week, we had Cliff, we had Sharon, and I know that you look after the Ascot residential homes in that particular area. Would you be able to share any particular vacancies, live vacancies, or is it just best to contact on that email address?
Absolutely everybody is recruiting. Even if they are not advertising, they are recruiting. So if you think I want to work in that place because it's closer geographically to me or it's easy for me or whatever else it might be, just pick up the phone and give them a ring. And if in doubt, the email address is there, please use it. I'm happy to put my telephone number on there as well. I'll put that on now. And if anybody's got any calls, you can give me a text or ring me if you want to as well, anytime. More than happy to talk to anybody.
That's wonderful. Thank you so much. Okay, well, I guess, we've got 14 minutes left of this session. If there are no further questions for Fidelma, you can stay, or you're welcome to leave at this stage. And I guess I'll open up for everyone to have a general discussion on anything else that they want to know about what's going on in the future of the vaccination program, and we can have a bit of an open discussion around that and what next steps look like. So I have basically got a free 14 minutes now. So if you guys want to discuss anything with regards to, next steps, what's going on with the program, potential opportunities, please do speak up. This is an open forum. It's a safe environment. And I'm happy to answer what I know. And if I don't know anything, I'm happy to sort of take that back and try and find out the answers for you.
Gaurav,
Yes.
I phone call yesterday from a lady. She's talking about deployment when we qualify as HCA vaccinators, that there was the possibility of being deployed to hospital hubs. Is that right? Good. I kind of, because I was having the conversation a bit on the go, so it sounded like we would be deployed to these hospital hubs, and she was talking about September.
So a bit like last year. So if you recall, last year we had the hospital hubs vaccinating all staff, and we had a site in Wexham and we had a site in Frimley Park. So this year the program's running slightly differently. I think there'll be a few more sites at the various locations. I'm yet to share this information formally, because I was hoping for a bit more intel before I did that. But with regards to those options, there will be now a requirement for not just registered staff, but for the for the band 3 vaccinator role as well, which I think is really a progressive step, because they realise the importance of having that cohort of staff. So it pleases me that it's not just the mobile outreach service that you could be vaccinating on, which is a given, but it's also going into the hospitals as well, which is a completely different environment. And I think this is so much exposure for yourselves, and it's really good for taking this effort forward.
Okay, thank you. Yeah, I think it's especially for me, it's about something that's local, and I can see that if we open up those hospital hubs for the workforce, there's going to be something that's kind of local for us to do. So that's excellent. Thank you.
That's right. Shaheen, Beverly.
Oh, hi there. I was just going to ask about how long you think that this vaccination role for us would go on. I mean, do you think it's going to go on just till probably December, or could it go beyond?
So the way that I see the program running is, as we sort of start to migrate towards Windsor Yards, which is the ultimate destination for the VC and the operation of the VC, we're going to continue with the mobile outreach service. There'll be a monthly allergy clinic. The antenatal service will continue at least until the 31st of December. The way the funding is being organised is that it will run till the end of the financial year. But what we need to see is how we get on between now and the end of December. And then somewhere between between those months, a decision will be made around January through to the end of March. And this is one of the reasons why I'm so keen to try and find as many opportunities to retain you guys in roles within the system as possible.
Oh, right. Okay. Thank you. That's grand. Thank you.
And I do apologize. I've got a very horrible tickly throat, so I'm going to continue to cough as I speak. But any other questions? Primla.
Hi, I missed the beginning, so could you just quickly summarize the team assistant role
Absolutely.
that was mentioned?
So a team assistant role will be very similar to the kind of bank roles. So there'll be shift work. There'll be very much front of house type of duties. So checking people in, using a system called, it began with Geronimo or something along those lines. So learning about that and observing post providing the blood. So it's very much a admin laden role. However, one of the areas that we did cover was that though it's a band 2 team assistant role, because of the urgent requirement of the role, even our band 3s could go across and do that role and get paid as band 3s. So there wouldn't be any sacrifice on the salary because it was for a band 2.
Right, so it's the people. So when I go for blood donation, it's the people that they check you in,
Correct.
and then set up the trays ready for the person that takes the bloods.
Absolutely. So they'll meet and greet, they'll sort of provide any information, they'll take them across to where they will get their blood drawn, and then it will be the post observation.
Right, okay.
So just to look at my notes there.
That's it, thank you.
Is that all? Okay, well, look, I just wanted to say thank you so much for all of you who have attended today and just your understanding throughout this process. It's never easy to sort of say, right, okay, we're going to move on and we're going to change the way we're doing this. But in a way, it's also a massive testament as well to all of the hard work that's taken place over the last 20 months or so. You know, we wouldn't be in a position to be starting to change the models of delivery if we were not having an impact. And I think because we've had an impact, we can afford to change the way that we work. We can afford to, you know, evolve the model of delivery and still have enough space in the system to retain you guys, because there's so much work still to do, but in other areas. So thank you for your ongoing support. Thank you for your commitment. We couldn't have done this without you. We're not going to be able to do this going forward without you. So that's why we need you. And we will continue as a team. And I say as a team, and I've done a really poor job of chairing this meeting because I didn't introduce my support mechanism, which is Patricia, Aishan, Mardia. They're all critical to the running of this operation. And I don't know if you guys want to show your faces, because they are the ones making the calls. They're the ones trying to engage with everybody. And without them, we can't do this. So just wanted to give them credit as well. So this is the team, this is the Workforce Bureau. And I know Samantha's not here and she's working in the background, but without these guys, we wouldn't be getting these opportunities and you wouldn't be hearing about them. So well done to all of you guys as well. And on that lovely note, without shedding a tear, I think I'm going to stop recording and we will communicate next week's schedule shortly. Any information that I get, I'll share that with you guys in the meantime. And other than that, have a lovely, safe weekend ahead of you and enjoy the weather whilst we got it. Take care now.
Thank you.
Bye-bye.
Bye.